Well, Lena really stressed the importance of partnership, particularly want to think about equitable access to technology and innovation, which I think is a perfect segue into our next conversation that is really looking at partnerships and how tech industry can partner with civil society, philanthropy, donors, other stakeholders to really ensure that these innovations are driving equity and progress. So I'll welcome to the stage Rumbi Chakamba to lead that conversation.
Thanks, Kate. As you mentioned, that's the perfect segue. So I'm just going to call our next group of speakers to come on stage. We have Nita Madhav, who's the Senior Director, Head of Epidemiology and Modeling at Ginkgo Bioworks. Naveen Rao, who's the Senior Vice President of Health at the Rockefeller Foundation. And Vivek Natarajan, who's the Research Lead at Google. So as Kate mentioned, in this next segment, we really want to look at partnerships. So just to get us started, can you share an example of an innovative health solution that emerged from a successful cross-sector partnership and what factors sort of enabled that to happen? Nita, I'll start with you.
Thank you, and thank you for the opportunity to be here today. One really good example I can think of is work that we've done at Ginkgo Bioworks in collaboration with the U.S. Centers for Disease Control and Prevention, along with XWell and other researchers and collaborators, to run surveillance programs in airports across the U.S. It's a traveler-based genomic surveillance program. And in this program, we are looking at travelers as sentinels for global circulation of disease. And what we do in this program is we actually are in airports and we have passengers getting voluntary nasal swabs as well as doing aircraft wastewater testing. And we're testing for different pathogens using PCR as well as genomic sequencing. And to date, we've enrolled over 370,000 passengers and operating in 9 airports in the US. And every week we're enrolling about 6,000 more. So this coverage is over 135 countries globally that these passengers represent. And so through this work, which emerged during COVID, we've found that this to be highly successful because it provides continuous value, continuous information that's actionable to the stakeholders that are involved. So I'll give an example about that. So one of the, what it provides us by being part of this program is we actually are providing insights about pathogens circulating that we may not get information about, where countries may not have surveillance systems in place, or we might not be getting that information otherwise. The other thing is that this program also provides us with early warning. So we found, for example, the Omicron BA.3 variant of the SARS-CoV-2 virus that causes COVID, we actually detected that through this program 43 days earlier than it showed up in clinical settings in the US. And that can really give you a lot of advance notice to do something.
That is fascinating. And Naveen, can you take us through something that you would categorize as a success?
So thank you for the opportunity. For a second, I thought we were in India, but no, jokes apart. I'm just trying to lighten it. It's been a long day. But what I would like to focus on is low tech. I mean, there's a concept that innovation is high tech. And then we all take off from that mindset, and then we try to justify saying, what about equity and how about access? But if you really go bottoms up, and you flip this over and say, instead of innovation as what we think they need, can we work with innovation as what they want and work it bottom up? So let me give you an example of that. So I'll start with the low tech, and if you ask me another question, I'll come back to the high tech end of things. But on the low tech, we partnered with the World Global Health Alliance, Wellcome Trust, and AMREF, and we put out a call for grants. These are small grants, and we put out a call for grants. And literally, we got over 1,000 applications for these grants. And they ranged from everything. From one end, how do you get politicians involved to make policy out of innovative approaches, all the way to how do you get community health workers the mental health tools to deal with climate change and mental health. So it was the whole spectrum. So the first lesson we learned was they know what they want. And I'm saying they, but you have to understand, when you go into communities, they know what they want. They also know how to solve the problem. They know the problem and they know how to solve the problem. The point is, are you willing to work with them? So the low-tech solution I wanted to talk about is communities that were dealing with high malaria literally needed to understand that if they drained the swamps, they found out which houses had the malaria, and usually these were the houses next to the swamps. It was a question of draining the swamps. And instead of high-tech innovations, they came up with a low-tech innovation that hardly cost anything, that they were able to drain all the swamps and bring the malaria count down tremendously, significantly, to the point where I look back and I say, sitting in air conditioning in New York, I could have never thought of that. So let's not just forget, innovation is always not high-tech. It's where the impact is and how do you build it ground up.
Thanks. That's such an important reminder. And let me just, okay, that's such an important reminder that it doesn't always have to be high tech, and the importance of engaging the community, because they probably have those solutions as well. Vivek, what are you excited about?
I think on similar vein, right? I think healthcare matters to everyone and is personal, and so it can't be like just one organization or one group of people innovating over here. It requires everyone to come together. And so at Google, we routinely partner with academic folks, with care providers, with pharma companies, with governmental organizations, with nonprofits. And these allow us to do different kinds of things. So for example, with academic partners or even with commercial partners, we sometimes team up to advance the research and validate the technologies that we are building in the real world. And so a good example of that is the work that we've done with Aravind Eye Hospital in India, where we've been able to take some of the AI models that were developed for screening and for detecting eye conditions such as diabetic retinopathy and validate them in real world settings. So that's one example where the goal is to advance the research. Another example is where we know that the models or the systems or the technologies that we've built have kind of worked, but now we want to scale them up in the real world and translate them into reality. So a good example of this over here is the partnership that we have with Apollo Radiology, where we've been teaming up to provide screenings for TB and cancer in India at scale. And then finally, we work with our ecosystem partners as well to build different kinds of tools and building blocks. And so a good example of that is the open health stack that many of my teammates and colleagues have built, which provide building blocks for developing apps in localized settings and contexts, including things like data operability and so on and so forth. And so over there, we leverage what, for example, the WHO has done with smart guidelines. And so you can see that these are all different stages of the innovation pipeline, and all of them requires you to partner up and team up, because that's what you need at the end of the day to innovate truly. So,
okay, thank you. Naveen, I'll jump back to you because I want to go back to the high tech for a minute. What role do you see? Vivek just mentioned AI and other digital tools and genomics. What role do you see them playing in advancing equity and ensuring that there's quality healthcare?
So having said what I said earlier, I now take that back. And now I want to say that just because you're going to the developing world doesn't mean you have to be low tech. You can also take high tech to the developing world. I see a lot of nodding heads. So it's about respecting the community and meeting them where they are. Let me give you 2 examples of high tech that we've taken, and it is really so encouraging to see that. The first example is in the city of Santiago. We are working with the ministries there and with the local communities there, and we have developed a digital twin of the city. Now imagine a digital twin of the city where the health authorities are plugging into the digital twin simulations of what will happen with heat index and what they're expecting, and how certain interventions they could do, and they're working on a digital twin to see what would happen if this heat, and these are so in Santiago right now there's a digital twin application for heat. That is an extreme example. The other one I can give you is working with the Colorado Public Lab, they have put out an instrument that measures the human toll of greenhouse gas emissions across the world. And this is a public tool that public can put in information, and so in real time to get the greenhouse. So the concept there is to humanize the data and to humanize the innovation, but it's high tech.
Thank you so much. I was trying as you're speaking to think of a sophisticated way of responding, but all I have is that's so cool.
There you go.
But yeah, Nita, I want to go to you. Can you give us examples of how this is advancing equity and some innovations that you see doing that?
Yeah, I think one project that I'm really excited to talk about is a new one that we've kicked off with a grant from the Bill and Melinda Gates Foundation. And this is a program designed around how to develop better methods for using AI to forecast measles in many lower and middle income countries. So I'm sure many here are aware, but measles continues to be an important driver of mortality, especially in young children. And a lot of the data that's coming out, especially when an outbreak is starting in a lot of these areas, the data are lagged. And so it's a very reactive approach to these vaccination campaigns. And I think folks are probably also aware that COVID created a real challenge with delays of vaccination on routine immunizations and many manner of other impacts. So this is a really important topic, and we're very excited to tackle this. So how we're approaching this is using tools built upon trying to use proxy information processing, satellite imagery, and other types of data to inform what the predictors would be, to really build a more proactive approach and predict where there will likely to be large outbreaks that would require these sort of vaccination campaigns. And the goal is to make these tools available for these countries to be able to respond to their epidemics in a way that's very effective.
Thank you so much. And Vivek, can you talk a little bit more about equity?
Yes, certainly. I think my work on my research is focused on primarily on large language models these days, and obviously there are a lot of questions around, like, in the development of these models and the deployment of these models, how do we address bias and how do we handle equity? And so one of the things that we've done recently is release a toolbox for health equity evaluations of LLMs, and so that's now, that's, I believe, one of the largest evaluations of LLMs in a health context from an equity perspective. And we've also released data sets that others can build on top of and use for evaluations. And so we expect to continue to be able to do that kind of work, where we put out tools, we put out resources, we put out guidelines in partnership with with academic collaborators, with ecosystem partners such as the WHO and nonprofit. But I think those sort of resources just will help us better to ascertain whether the technologies that we are building are really doing what they are supposed to be doing, which is to really scale up and democratize access and not amplify existing disparities. So that's the kind of work that we expect to continue to do on an equity front, and as well as making sure that we are incorporating best practices.
Thank you. I want to jump into barriers to access next, but before I jump into that section of this, I want to ask our audience if anyone has got any questions for our panelists. We're probably able to take a few. You can just lift up your hands and we'll bring a mic to you. Any takers? There's one right in front here. Here's a mic.
Oh.
A question for Nita. I'm fascinated with the work that you're doing, particularly in U.S. airports, and I didn't hear what you've found so far from it. So I'm sorry if I missed that, but I think, as you said, predictive. I did hear about the Omicron variant answer, but I'm wondering if there are other things you're finding, and is it mostly, because you mentioned it's wastewater and it's people volunteering to have the nasal swab, so I'd also love to hear from which one you're gathering more relevant data.
Oh, thank you. That's a great question, and I think we could probably spend a whole panel just talking about that. So maybe we can talk afterwards as well. I think some of the really key highlights are, being able to identify, especially with the voluntary nasal swabbing, you can actually, although we're not specifically tracking passengers, we do get some information. They fill out a kind of a questionnaire when we do the samples, and so we can kind of figure out what countries that they've been in and things like that. So that does kind of help us to fill in certain gaps. So for example, we might see some samples of SARS-CoV-2 coming from countries that have stopped reporting it altogether. So we have seen that, for example. We have seen, like you said, like I mentioned earlier, some of the new variants, when they pop up, they show up earlier in sometimes in the aircraft and passenger monitoring. So I think those are a couple of examples, and there's probably a lot more that we can chat about later.
Fantastic. I'm able to take a few more questions if anyone, we have one in the middle.
I thank you for this amazing event and the panel. My question is to Dr. Rao, and you mentioned that we should certainly take high-tech solutions to LMICs as well, and this is the time to do so. But the question that comes in is the cost. And I want to know how do you answer those questions, because whenever we propose some high-tech solution, they're like, oh, no, this is not cost-effective enough, although it is, but there's not enough data for it. So how do you answer when you go into such settings?
Thank you. The old-fashioned way of doing things used to be, can you give less to more people for less money? So for example, if you had a 12-lead EKG in the developed world, could you give a 3-lead EKG, so give less to more people because it'll be cheaper? So the thinking was, can you give less to more for less? But the trick is, if you can find a way to give more to more for less. And there are examples. I mean, the first example that came to my mind was when they built the nano car in India. They were trying to build it for under $1,000, so more people could afford it, so for more. And there, they actually put bucket seats that were aerodynamically designed for aeroplane cockpits into the car. So they were able to actually give more to more for less. And so the trick is to think that way. And another example that comes to my mind that drives home this is they're delivering blood via drones in large part of the third world. Now, how are they going to afford to send blood by drones? But it is amazing how successful it is and how they've been able to break it. So it is a mindset thing. Can you enter it not just thinking less is always cheaper, but there are times when more is cheaper? I don't know if I've answered your question, but it's a mindset.
Thank you so much. I have time for one more question, which I will take myself. So we've spoken a lot about so many interesting innovations, and both, I think, in high-tech and low-tech scenarios, there are always barriers to innovation. What are some of the barriers that you guys have encountered in your work, and how can people overcome this? And I'd also maybe put this to you, Naveen. I would also want to know, like in low-tech settings, like you mentioned that you had all these grants and they came up with such simple solutions, but what are the barriers for them to come up with such innovations, for communities to come up with such innovations for themselves? So I'll start with you.
Thank you. For me, there are two big barriers, and I think these barriers cut across many things, but they come to a sharp focus when it comes to health, and it comes to a sharper focus when climate is triggering these health issues. Political will and financing. Those are the two big barriers in my mind. If you can manage the political, if you can get the political will and you can get the financing, there is no dearth of ideas, innovative solutions, people wanting to take a chance. So the 1,000 can become 2,000 applications very easily. The issue is there a political will and a financing backing? Because if there isn't, then after a while, people stop trying. So we, for example, on the financing side, along with many in the room I see, put together the guiding principles to bring more financing into health during this climate crisis. We launched it at COP28. It's the start of a journey, but we need to get more money into climate and health. And when it comes in, it has to go to the right countries. And when it gets to the right countries, it has to be easily accessible. Right now, some of the paperwork that comes with these application forms just don't allow the people who need the money to apply and get it. So the financing is a barrier. We need to get more money faster, cheaper, and transaction free. But on the political will, I think the only way to get that going is to actually have data and research and show the politicians how this actually helps them in their bids for power and politics and whatever is important to them. We went into the state of Karnataka in India because they wanted to put together a dengue dashboard. And the health department didn't know how to get the politicians on board because the dengue dashboard was being put up as a moral issue. When we went in and we realized very easily by overlaying weather forecasting maps, we were able to predict through algorithms and through AI which parts of the state would actually have the next wave of dengue. And it was in a different part of the state. But then what we did is we tied that to the economic impact. And that's when the politicians woke up. So for me, it is, can we talk the political language? And just talking the health language and the moral aspect is not enough. We need to be able to talk the politicians' language. And so that is the barrier that we need to overcome. But that is, again, based on us to be able to meet them halfway and not just expect political will and political backing to happen because it's a moral issue.
Thank you. And Vivek, so financing and political will, are you experiencing any other barriers or is it the same for you?
I think it comes down to, like, I tend to assume good intent and good motivations in all people, and everyone wants to have impact and help out in settings and like really help scale up. And so I think the key challenge is always like evidence that something works. And so do we have the underlying infrastructure to be able to measure when we are deploying something and show that it is meaningfully improving outcomes? And so for me, it is that infrastructure, it is that base layer that we need to build out in different ways, like democratize tools and provide people the ability to measure when they're deploying something that it's having meaningful impact, right? And so the more we are able to do that and show that, then I think financing will come in, the political will come in. And so I think for me, the base layer is just the infrastructure that we need to be able to measure things better. And that I think is the key barrier towards innovation in low resource environments at this point of time today. I think we have the infrastructure in Western countries, but we don't have the same amount. And so being able to set that up and providing tools and resources and like also the technical expertise needed for that is, I think, the key.
I imagine it also takes financing to be able to measure a success. Do you see that? Do you see any, I guess, political will to actually put financing into also measuring success? Because I think it must be hard to get financing to do the project, and then in addition to that, you also need to measure. Are you seeing this understanding that you need to do both?
I think I come back to what Naveen said earlier, like there are ways in which we can do this where we can provide more for less. And so it's not always a question of financing. It's about like being creative in how you build tools. And so the same, like for example, Android is used everywhere, and this is, I'm speaking in a personal capacity, but like can we like build in software solutions and tools into Android so that like you naturally get things for free on top of what you have with your feature phones, right? And so can you like build in measuring technologies in for free? So those, I think again, that's the mindset that we need to have, and as technologists, we need to bring in that mindset. And the other thing is to understand what problems need to be solved and being open to that. And so I think those are the two things. It's not always like, oh, we need financing, otherwise we can't solve this problem. I think it's more about being creative as well.
100%, because when you mentioned it, I'm like, where's the money coming from this? And immediately, if I looked at it differently and I was like, before, when we're producing this, we should also put that in place to be able to measure. So I really understand what you say when you say it's a mindset change. I will come back to you, Naveen, but I just want to jump to you, Nita. Oh, thank you. My aha moment. Nita?
Yeah, I just wanted to kind of pick up on some of the points because I wholeheartedly agree that the financing aspect is really important, very challenging, and I think we have to keep in mind that the health equity, health systems is really a whole of society issue, and so the financing, the funding really should be coming from other sectors as well. And I think there's been a lot of discussion lately about building better bridges to national security is also another way of bringing in more types of funding. But one issue I haven't really heard discussed yet is I think a lot of times the private sector is not as well represented as it could be in a lot of these discussions. I think there's been a lot of discussions of the private sector and medical countermeasures, for example, or infrastructure or telecom. But I think when it comes to more of the really traditionally what's been run by governments and public health type of setting, I think there's still a lot of hesitation of welcoming in the private sector, and I think that could also be something that could really improve the situation if they are.
Vivek, do you agree? Do you see that disconnect with the private sector?
No, not really. I feel like, yeah, I think with Google, I feel like I'm privileged to work at a place where there's a lot of trust.
We're not going to turn you away.
Yeah. So, I don't necessarily run into that.
Okay. And in our final minutes, I just want you guys to give us a few key takeaways that you'd want people to walk away with in terms of like creating these partnerships that actually work. What would you want the key takeaway to be from this session? I'll start with you, Naveen.
Key takeaway for me is respect the community.
Okay. And Vivek?
I think I just want to echo what Naveen said earlier, which is like the mindset shift over here, right? I think thinking about like how we can do more from less and being creative about the solutions that we are building. And again, like bringing everyone together in the journey along with us. So.
Thank you so much, Anita.
Yes, I think kind of picking up on some of the earlier points that Naveen made about really, listening to the folks who are, living it every day. They oftentimes will have the best solutions in mind, and so, I think coming in as a partner to that, being able to engage in co-design and co-development of these types of programs very early on, not coming in with a solution and saying, aha, we have the answer for you, but rather, having that form organically through the collaboration, I think is very critical.
Thank you so much. I've learned so much from this panel, and just want to thank you for joining us, and I'll hand over to my colleague, Kate.
Well done.